Good afternoon. Welcome to the Hudson Valley Rural Geriatric Education Collaborative webinar series. My name is Annette Thomas, and I am the program manager for this collaborative. I am so excited to share with you this monthly webinar series that will cover various topics relating to rural health and geriatrics. Before we start, I would like to ask that you please have your telephones and audio equipment on mute. Thank you. Today's webinar is an introduction to veteran-centered care. Our speaker for today is Dr. Andrea Sherman. Andrea is a gerontologist, teacher, public speaker, and trainer, and serves as curriculum consultant to the Bronx VA HVRGEC program. As an educator, her focus extends to transforming long-term care, life cycle transitions, caregiving, and end of life. She is co-founder and president of Transitional Keys and the co-founder of Seasons of Care. Andrea is also a curriculum consultant to the National Center for Creative Aging and previously to the Washington, D.C. Area Geriatric Education Center Consortium and to NYU College of Nursing, where she directed the Geriatric Education Center. She has presented numerous trainings, webinars, talks, and workshops throughout the country and Canada for more than 35 years. Dr. Sherman?
Hi, everyone. I'm delighted to be here today. Good afternoon. And thank you to HVRGEC, to the GREC, to the Rural Health Training and Education Initiative, and to the Veterans Affairs here in the Bronx. Special thanks to Dr. Judy Howe, Program Director, and to Annette Atanas, Program Manager. I'm delighted to be here today to present on the topic of veteran-centered care. Today, we will define what is veteran-centered care and identify some of its characteristics. Look at the reintegration of veterans and aspects of the medical home, focusing on the partnership of the veteran, the family, and the healthcare team. Here are some of the initiatives that are in the VA. In 2009, a task force, a Universal Service Task Force report was released. It was a system-wide cultural transformation, and they identified 12 key attributes that incorporate system redesign, team-based care, and continuous improvement and quality management. The Veteran-Centered Care Initiative is a transformative culture change initiative, and it focuses on honoring the veteran's expectation of safe care and enhancing human interaction and therapeutic alliances, soliciting and respecting the veteran's values, preferences, and needs, systemizing coordination and continuity of care, empowering veterans through continuous information and education, and food, focusing on the nutritional, cultural, and nurturing aspects of food. Providing physical comfort and management of pain, and ensuring emotional and spiritual support, as well as involving family and friends. And providing an architectural layout and design that is conducive to health and healing, that includes the creative arts in the healing environment, as well as supporting and sustaining an engaged workforce to providing veteran-centered care. So what is veteran-centered care? The first characteristic is to honor the veteran's expectations of safe, high-quality, accessible care. And it's defined as a fully engaged partnership of the veteran, the family, and the healthcare team that's established through continuous healing relationships and provided in optimal healing environments in order to improve health outcomes and the veteran's experience of care. And you can see by this image of transforming veteran-centered care that in the very center is the veteran. And the veteran is surrounded by evidence-based practices, team care, patient-centered approaches, and continuous improvement. Secondly, veteran-centered care enhances the quality of human interaction and therapeutic alliances. It's a focus on human beings caring for each other, ensuring human interaction, and developing an awareness of the language of this interactive care. And you may hear words like person-centered, veteran-centered, patient-centered, or patient engagement. And often these words are used interchangeably, but they all describe the veteran at the center of care. Person-centered or veteran-centered care is a focus on the veteran. And we ask, how can I help you live your life fully? We put the veteran, the person, at the center of their lives. And family and staff are an integral component in this model of care. The third attribute is to solicit and respect the veteran's values, preferences, and needs. The veteran, the patient, drives the care. And there is this process of continual revision and assessment to truly ascertain and honor the veteran's preferences. The patient-centered primary care is the conduit. But all care providers, anyone who cares for a veteran, needs to focus on what the veteran's desires for care are. Everyone. In veteran-centered care, it starts with the person, not the problem. And as Dr. Tracy Gadet, who's director of the VA's Office of Patient-Centered Care and Cultural Transformation, has said, veterans committed their lives, health, and well-being to mission success in defense of our country. Now we can help them be mission-ready for their lives, optimizing their health in service of what matters to them. We will identify success when veterans achieve outcomes they never even imagined possible. And you can see in this image on the screen that the veteran is at the center of care, focusing by the healthcare team on him. In this chart, we take a look at traditional versus veteran or patient-centered care. And in traditional care, it's provider-centric, whereas in veteran-centered care, it's patient or person or veteran-centric. Traditional care is disease-oriented, and veteran-centered care is health-oriented. In traditional care, the focus is diagnose it, cure it. In veteran-centered care, it's identify risk and minimize it. Traditional care is a biomedical intervention, whereas veteran-centered care has a whole person, holistic focus. Traditional care is reactive to illness, and veteran-centered care is proactive to health. Traditional care is sporadic, and veteran-centered care is ongoing and lifelong. In traditional care, it's the patient who enact, and in veteran-centered care, the vet chooses. Finally, in traditional care, it's system-centric, and in veteran-centered care, it's veteran or person-centric. The fourth attribute is to systemize and coordinate continuity and integration of care, with the goal to provide continuity and integrated care. Patient safety is key, as is leveraging technology to improve care. Again, anticipating the veteran's needs and being proactive. Care managers facilitate care interaction. And this coordination of care is important across the many care settings and through the many transitions of care that veterans may face, and that you as healthcare providers face caring for veterans. This new model of veteran-centered coordinated care has key elements such as the medical home, preventative care, virtual medicine, telemedicine, telehealth, and hospital quality and transparency. The VA Patient-Centered Medical Home Model, or the PACT, Patient Allied Care Team. In this image, we see the medical home surrounded by care. It's a patient-driven, team-based approach, and it's launched with primary care clinics. It's comprehensive and continuous, and coordination and communication are key. The medical home model provides access to care through diverse methods and medicines. It's particularly strong in improving chronic disease management, which, as we know, can be challenging for veterans and for their caregivers and care providers. In the PACT model, there may be daily huddles of the entire team that meet to plan the day, to anticipate the patient's needs, perhaps to look at the schedule a week ahead of time. It uses the medical home neighborhood model with nutrition, pharmacy, social work, psychology, psychiatry, palliative care, and chaplains. It's a neighborhood of care. The fifth attribute is to empower veterans through information and education. As they say, information is power. Illness is viewed as an opportunity for education. Improving access to care and information, counseling for women veterans, access to care in rural areas, ensuring that best practice models are implemented. Eliminating homelessness is an important component. According to a count on a January night in 2012, there were 62,619 veterans who were homeless. The goal is to end veteran homelessness by 2015. There's a Homeless Veterans Outreach Initiative looking at poverty, lack of support from family and friends, substance use, mental health challenges, and PTSD. An interagency council on homelessness called Opening Doors was formed. Now, homelessness describes living conditions, but it doesn't necessarily identify the individual's needs and aspirations. The data shows us that almost half of those who are homeless are from California, Florida, Texas, and here in New York. 53% of individual homeless veterans have disabilities. There are high rates of homelessness for Hispanic, Latino, and African Americans. Recovery is seen as a personal journey. There is an effort to focus on wounds that we cannot see, on the emotional scars of service that contribute to homelessness. Preventing suicide is another important component of veteran-centered care, and providing information and education for veterans. In just 2 years, the VA Suicide Prevention Hotline has helped more than 100,000 veterans, and the hotline can have up to 350 callers a day. It takes the courage and the strength of a warrior to ask for help. Healing from multiple losses is a common theme. This is a slide of the Vietnam Veterans Memorial Wall in Washington, D.C. that honors those who served in the Vietnam War. The wall was designed by architect Maya Lin. There are more than 58,195 names on the wall, either of those who died or those who are missing. The National Veterans Art Museum inspires greater understanding of the real impact of war, with a focus on Vietnam. The museum collects, preserves, and exhibits art inspired by combat and created by veterans. Located in Chicago, the museum offers a place and a space to open the dialogue on the impact of war. Here we see a painting called Generations of War by Nancy Ridgway. Nancy served in Vietnam as a nurse with the Army from 1967 to 1969. Since then, she has expressed her experiences through a diverse range of mediums, from collage to photography and poetry. Her artwork is soft and warm in nature, often putting a twist on familiar symbols such as the American flag. By understanding Ridgway's background as an Army nurse and recognizing the approachable nature of her work, we can see how she creates a safe, welcoming place in her artwork for those familiar with the strife of war. And we're happy to have a new relationship with the National Veterans Art Museum, which will be providing art for this series of webinars. So a special thanks to them. Food is key. And the sixth attribute is incorporating the nutritional, cultural, and nurturing aspects of food. Nutrition is important to healing, and food is a source of pleasure and comfort and familiarity, and it supports wellness and disease prevention by promoting healthy food choices and counseling for weight control and health improvement. Kitchens being made more available to prepare foods, to smell foods, and to taste foods. Seventh is providing for physical comfort and management of pain, ongoing pain assessment, and incorporating non-traditional pain management and integrative medicine strategies, such as visualization, yoga, meditation, acupuncture, biofeedback, mind-body therapies, and chiropractic. The focus is on prevention, on reduction of risk, and maintaining health and function. Injuries often lead to prolonged recovery and rehab, and the coping of persistent pain. This is part of the stress of reintegration, and there is a need for compassionate care to manage pain for veterans across healthcare settings. Facilitating reintegration for veterans is a part of veteran-centered care. The VA has a post-deployment integrative care initiative that was initiated in 2008 for integrated post-combat care. And it's important to understand and operationalize military relevance and military culture and how these affect the recovery of the wounded warrior. This reintegration is complicated by physical and mental health conditions, as seen in this artwork installation called Prayer Boots by John Turner at the National Veterans Art Museum. John Turner served for the U.S. Marine Corps from 2003 to 2007 and received the Purple Heart after his 2 deployments to Iraq. Like many veterans, Turner fell victim to PTSD after his discharge and subsequent reintegration into U.S. culture. In an effort to quell the internal battle he had brought home, Turner began expressing his trauma through art and writing, and this led to his involvement with several veteran-oriented programs, such as the National Veterans Art Museum and the Warrior Writers. Turner has recently released a new book entitled Reasons to Find a Stream. His artwork generally features soft pastel colors, littered with drawings in thick, black paint. Turner will often pair these with single-word commentary to communicate his understated meaning. He says, "All I can do is look back, learn, and progress forward." These boots that we see are a symbol, a strong symbol for veteran-centered care. Who is the veteran, the person in the boots, and what is she or he praying for? Reintegration also may mean reintegrating from war-related injuries and illnesses and amputations, as we see here with these 2 men in the slide. Part of the demographic growth in veteran-centered care is the increased number of women in the military. Women have been a part of the military since the inception of the Army Nurse Corps in 1901. 8% of the current population of veterans are women, and by the year 2035, this will be increased to 15%. Women in the military means improving access to care for women, access to benefits and services, and ending veteran homelessness, 8% which are women, increasing caregiver support, and beginning to break the back of the claims backlog, honoring all women who have served. 8th is ensuring emotional and spiritual support to veterans. Spirituality is that which allows a person to experience transcendent meaning in life, Whatever beliefs and values give a person a sense of meaning and purpose in life. And this is a quote from Christina Polchowski. She's done extensive work on taking a spiritual history at GWISH, which is at GW. Spirituality is vital to healing the whole person, the whole veteran, and experiencing meaning and purpose in life, particularly with a focus on making meaning out of the trauma of war. Spirituality has a role in healing the veteran, and it supports patients and families and staff in connecting with their own inner resources. Chaplains are viewed as part of the health care team, using the chapel, the meditation rooms, gardens, labyrinths for healing. Healing at the end of life, treatment for the whole person, is a part of veteran-centered care. We find that sometimes at the end of life, veterans have a wish to better understand the traumatic events of combat and the impact of the military experience on their spirituality. Ninth characteristic is encouraging the involvement of family and friends. And as we see in the image, the woman saying, "You're there to support your veteran. We're here to support you." Veteran-centered care is a partnership among veterans, families, friends, and the healthcare team. To support the family, a Veteran and Family Council was formed in 2010. It fosters resilience in families affected by adversities. We know that caregivers to veterans are unique. They may provide care for many years. They themselves may suffer high emotional stress and strain and may face financial hardship as well as PTSD. Supporting family caregiving supports veterans. Veteran and family-centered care empowers the veteran and the family member with information, education, and shared decision-making. Social support is recognized as truly vital to good health. There might be family overnight stays, and I think this is key. Education about mental illness, particularly about medication management and transitions of care. Pet inclusion programs. It's an interdependence between the veteran, the family, the spouses, the children, the parents, and friends. 10th is to provide an architectural layout and design that is conducive to health and healing. And the most pioneering work and recognized advocate of this is Planetree, which has been adopted by the VA. They have refined 10 key principles. There are hundreds of Planetree affiliates around the world. And in a Planetree environment, you might see an abundance of natural light, of easy workflow for services to veterans, perhaps soothing colors, and group spaces for treatment and education, elimination of environmental and noise, and spaces for solitude and social activities. Introducing creative arts into the healing environment is the 11th attribute. And this is an image from a Planetree oriented VA in Los Angeles. And the stairways are painted. You can see a mural, a very soothing mural of water and palm trees. And these stairways create a more home-like atmosphere. Hopefully encourages veterans and staff to use the stairs. So artwork is also in veterans' rooms, and there's a display of community art, a change of scenery, and linking healing environments through art is key. The last attribute is supporting and sustaining an engaged workforce as key to providing veteran-centered care. There's a focus on staff-centeredness, a link between caregiving and veterans. Perhaps there's flexibility in the workplace or staff retreat, meaningful awards for staff, respectful interactions, the promotion of leadership, and nurturing a work environment that is supportive of staff. So in summary, veteran-centered care is a fully engaged partnership. It's a partnership with the veteran, the family, and the healthcare team. The veteran is at the center of care. It starts with the person and not the problem. Eliminating homelessness and suicide are key to veteran-centered care. Reintegration for veterans and family are crucial. And focusing on the needs of women veterans is a priority. Improving access to care in rural areas is a focus of veteran-centered care. And delivering care through virtual medicine, telehealth, also is a part of veteran-centered care. Providing excellence of care to veterans, to partner with veterans and optimize their health in service to what truly matters to them. That is veteran-centered care. We've given you some resources here. And the first one, Healthcare Transformation, actually has the 12 attributes that were the framework for this presentation. If you want more information on VA services for homelessness, that's the second one. And the third link is to the VA Office of Patient-Centered Care, where Tracy Gadet is the director of it. The following link is to the Rural Health, which will give you more information about initiatives there. And then the next is on the medical home and the PACT, the Patient-Aligned Care Team. There's a great clip on a radio story of a new initiative using music with nursing home residents that have dementia and iPads, and some marvelous work in having people begin to be more alert through music. The next link is on joining forces, and it's a kit, a veteran-centered care toolkit. If you're interested in learning more about family-centered care for the military and veterans affected by combat, the first link on this page will help you. And then for more information about pharmacy, the link on patient-centered approach to pharmacy. What does the future look like for VA healthcare is the following link. And then there's another link on dementia care and art fusion. So we hope these will be helpful to you and providing more information about veteran-centered care. Again, we thank you for your participation today, and we thank you for caring for our nation's veterans.
Great. Thank you so much, Dr. Sherman. This concludes our webinar presentation. We will now open up for questions and answers.